How do I shop for that specialist?
Well, generally speaking, if you're going to an accredited surgery center or hospital, that work's already been done in terms of validating those people's credentials. Most commonly, it's a physician who spent years in postgraduate training, and that would be somebody like myself, an anesthesiologist. There's another group of anesthesia providers called certified nurse, registered nurse anesthetists, and depending on where you are, you may be taken care of by an anesthesiologist or a nurse anesthetist, but you definitely don't want the surgeon's secretary giving you drugs.
No, thank you, unless, of course, it's recreational and out on the street.
Right. You know, a vodka martini is another story.
But speaking of recreational, is this being used, propofol? If it's a happy drug, is it being abused by people?
Unfortunately, yes. As we've learned in medicine, anything that can make you feel good is a source of abuse. And in fact, a very small number of anesthesiologists are taking what they call a white rabbit nap. It's very short on, very short off. They feel very good when they wake up. Unfortunately, if they take just a little bit too much and there's nobody there to watch their airway exchange, they die. Because that's what happened with Michael, is you lose your airway, your ability to clear your airway, and school's out in very short order.
What about the nausea factor?
Well, this drug, interestingly enough, is a very powerful anti-nausea medication, and the technique that I've developed avoids the use of the two classes of drugs which are most commonly used, which are also the source of the nausea and vomiting afterwards, and those are the stinky gases that people breathe, and the intravenous narcotics like morphine, Demerol, fentanyl, those types of drugs. It's completely unnecessary.
Wow.
Yeah, it is a wow.
Have you gone under, Pat?
Oh, yeah. Oh,
yes.
yeah. In fact, just shortly before we started the show. No, you know, I have been very, very honest with the audience about the only chronic thing that happens constantly to me, and that is kidney stones. And when you have kidney stones, you are right now immediately saying, please point me at the nearest anesthesiologist. But you also have to be careful, because if they gave me morphine, that was fine immediately. But the reality is there have been a couple of times when I was on it too long, and then I had an apnea problem.
Exactly. That's
with
lack of breathing. That's the technical word for not breathing, which is what Michael Jackson's problem was, not from morphine, but from the propofol. Yes. Sometimes people facetiously say one of the theme songs for anesthesia is Takes Your Breath Away, or Blue, Blue, My Love is Blue.
Stand-up material. Gosh. When he's not in the office, not in the OR, he's at the Improv.
One of the things they say about anesthesiologists is that they're surly to bed and surly to rise.
Okay, so you do a lot of cosmetic surgeries,
yes,
anesthesia for cosmetic procedures in California.
Yes.
Why do I hear in the media oftentimes that people die when getting liposuction because of the anesthesia? I don't hear it of other procedures being done, mostly liposuction.
There was a spate of deaths in the late 1990s that precipitated the regulations in Florida and California, stating that in Florida, for instance, no more than 4,000 or 4 liters, and in California, no more than 5 liters. When people exceed those limits, toxicity from the lidocaine and the fluids that are used can be a problem and cause death. So you really want to be with somebody who has their head on their shoulders and understands the limitations, because like everything we do in medicine, there are limitations. And if you're not going to respect the limits, sooner or later bad things will happen. And that's why you hear about those deaths.
I'm perfectly happy to have you go into your later years as a very, very successful and wealthy doctor. But I am going to ask you about something that might cut into your income. Your parents spent a lot of money sending you through Temple and Stanford, and I'm sure they don't regret that. But there are Chinese doctors who use only acupuncture, and apparently they've been doing it successfully for thousands of years. What about that?
Well, it's funny you should ask. In 1972, when I had my first brush with anesthesia as a medical student, I was very, very excited for the same reason you are. And it turns out that acupuncture was indeed used predominantly in China because they had a lack of access to Western medicine. Now that they've had it, they use it much, much less. Acupuncture works wonderfully for 40% of people. The problem is there's no way to predict in advance which 40%. So you get started, there's an ouch. And the other factors in China, of course, that there's a dramatic difference in the social relationship between physicians and their patients. Pain is a more accepted part of life in the Chinese culture than it is in our culture. For instance, by religion, I'm a devout coward. And so, you know, when I had my hip surgery done and I didn't have pain for 4 days after surgery, this was a tremendous validation of the technique I've been doing for the last 18 years for my cosmetic patients, we were talking about the ketamine and the propofol, and those are the other elements of Goldilocks anesthesia, which is, measure the brain, don't hurt the patient on the operating table, and don't give them drugs that make them sick to their stomach. It may not be Nobel Prize material, but whatever the prize below Nobel Prize is, that's it.
And what about hypnosis?
Well, again, you have the same issues you have with acupuncture. It works very well for 40% of patients. It's just impossible to predict in advance which 40%. Although the people who do hypnosis for entertainment are pretty good at finding the people who are suggestible.
So this sounds like it's become extremely safe, monitoring the brain. You're able to not have as many deaths as there once was from anesthesia. Do you still recommend that people do other options if they can and not have anesthesia?
Well, it's kind of hard to ask the guy who sells meat if they recommend vegetarianism. I mean, anesthesia is my life. It's been what I've done for 33 years. And I certainly tried to avoid surgery when it came time to have my hip done. But once I exhausted those options, I went to acupuncturist and I did massage therapy and all that other stuff. At some point, you run out of options and you say, okay, how can I make this as safe as possible? How can I be sure that I wake up with the same number of marbles that I started with? Because that's really the shorthand for people. So, well, what's the big deal? I mean, my anesthesiologist says that, he doesn't need this monitor. He can tell what's going on.
You got to use the marbles. You got to use the prop.
Right.
Doctor, listen, thank you so much for joining us. And I'm assuming that if people have any questions at all when it comes to anesthesiology, that they can get in touch with
GoldilocksAnesthesiaFoundation.org, info@GoldilocksAnesthesiaFoundation.org, or drfriedberg.com.
We are monitoring Angela's brain, and it says...
She's very smart.
Says don't ask anything about sports. We'll be back in just a moment on the McMahon Group.